Hi, I'm Lanil Mitchell from the Physio Gym and physiogym.com, and I'm here today to present to you our mobility self-assessment. Probably the number one thing that I've learned in my career is that non-contact injuries are almost entirely preventable. So you might ask, what's a non-contact injury? A non-contact injury happens when you're, especially in sports, when you're just running down the field and boom, something blows out or you pull a muscle. A contact injury happens from something, for example, as a car accident, or you get hit with a baseball bat where there's actually some type of contact. An overuse injury is also a type of non-contact injury that happens when you're just doing something in your normal daily life and you experience a significant pain. You might be going to bend over to grab something or just walking along and all of a sudden you feel a sharp pain. And basically we're seeing exponential rates of non-contact injuries, and the most important thing to understand about them is, probably more than 99% of them are entirely preventable. So physical therapy used to be a profession that only worked with people after they had an injury or a surgery or after they were experiencing pain. Well, we've entered into a new era where physical therapists are being utilized to help prevent injuries. The best physical therapists and the best trainers are educated in what's called an evaluation-based protocol. And what that means is that we're not going to take action and do anything in terms of stretching or icing or any of that before we do an assessment or an evaluation to determine exactly what is needed. And evaluation-based protocols are what we see used at the highest levels of performance and in physical therapy. We do, however, have one big challenge with this. Insurance doesn't pay for it. So I've put this mobility self-assessment here for you to be able to get the answers to the questions that you're looking for. So you may say, hey Lanil, why is this so important and where is this philosophy coming from? But it's already there in your daily life. Much like a dentist, our goal is to try to figure out what's wrong with your body. So if we can take a look at your body before you actually experience an injury, there's a high likelihood that we can help you prevent an injury. I've always also found this very interesting because, routinely we get our blood pressure and our heart rates checked. As a preventative measure. You're going to go into the doctor's office, those are going to be one of the first two things that they look at. But on your daily life, especially if you're somebody into fitness and sports, most of us aren't even sure how to determine whether our hamstrings are tight or not. And as with any improvement or performance program, we know that one of the best things you can do is have somebody mentor you through the process or use a guide that was developed by an expert to determine what exactly you need to do to get through the process. I always think about this, and it's kind of a joke, but you wouldn't try to go skydiving for the first time by yourself because it could end up in a catastrophe. Now we know that fitness and training and things like that aren't necessarily going to have the same magnitude of seriousness when it comes to that, but it's the same type of principle. And I'm here to be your guide and give you the plan that you need so you can start helping yourself improve your mobility and have an understanding of whether you're potentially at risk for hurting yourself. One of the things that you might be having an issue with is your posture, which ultimately leads you to having issues with your neck alignment and your head positioning. And so the first test that we're going to go over here on the mobility self-assessment is your neck range of motion. When you're doing some of these assessments, especially this one, you're probably going to want to get in front of a mirror or use your phone or your computer to do a video recording of yourself so you can see exactly what you're doing. In the physio gym and sports muscle technology, the philosophy is that your head leads all of the movements that you do. If you're an athlete, you probably recognize this, and this is something that we talk, the hips are really important, but your body goes where your head goes. So in the first test, looking up and down, you should be able to tuck your chin down to your chest and then ultimately look back and up towards the ceiling so your eyes are at the highest point, and you should be able to do this without pain. So the first thing is that you want your head to be over top of your body, right, centered over top of your chest in the right alignment. In the second test, you're going to look over both shoulders. You should be able to look over both of your shoulders behind you with equal range of motion. And the third assessment, what you're simply going to do is try to touch your shoulder, the outside of your shoulder, to your ear. And we're going to tilt down and bring the shoulder up to the ear. It's okay if you raise your shoulder up. You're gonna do that on one side, and then you're gonna do that on the other side. And also what we wanna look at is to make sure that you don't have pain in that normal range of motion. If you have limited range of motion or pain, this is something that you probably want to have seen by a physical therapist or even potentially a physician. So if you have any what we would call radicular pain, which means that you get shooting or burning pain that goes down your arms, one side or the other, or in both arms, you definitely want to get to a medical professional to get that screened out. And just like the first test was a simple range of motion exercise, this next exercise or test is going to be a simple balancing exercise. Most people don't realize that they have deficits in their balance, and this is a really quick and easy self-assessment to do to determine if you do. All you're going to do is shift your weight onto one foot, pick your other foot up off of the ground, and stand and control your balance and hold it. You're gonna do this for about 10 seconds. 10 seconds would be considered normal, right? And then you're gonna switch, put that foot down, switch to the other foot, and hold that position, count to 10 as well. Now, if you can do that easily, the real test is can you do it with your eyes closed? So this next test is called the prone press-up test. And all you're going to do is lay down on your stomach, face first. You're gonna put your hands underneath of your chest like you're going to do a push-up. Then all you're going to do is look up towards the ceiling, and you're gonna press your chest back away from the table or the floor, noting that you want to make sure that you're keeping your pelvis down on the table. The first part of this assessment or test is to really clear and screen to make sure that you don't have any pain. If you have any pain in the front of your hips or in your lower back, we would consider this a fail or needs improvement. And in the second part of this test, we're gonna look at your range of motion or your mobility. And what we wanna see is your ability to keep your pelvis down on the table while you go to press up, and then fully be able to extend your elbows. If you can fully extend your elbows without having any pain in your lower back, we would consider this a passing test. The next test in the mobility self-assessment is going to look at your ankles, and it's actually a two-part test. In the first part of the test, you're going to find a wall. You're then going to line your toes up along that line, keeping your heel down, which is the critical part to this test. You have to keep your heel firmly planted. You're going to drive your knee straight over top of your toes and try to touch the front of your knee or your kneecap to the wall. If you can touch the wall with the front of your knee, that is considered a passing test. If you cannot touch your knee to the front of the wall, that is considered a fail or needs improvement. In the second part of the test, we're going to look at your plantarflexion range of motion or your mobility, and we're going to have you kneel on the ground or on a table, and you're going to try to sit back with your weight on your heels with your toes down. Your shoelaces are going to be facing down on the table, and what we want to see is that the top of your foot is able to stay firmly in place with the floor. If the top of your foot is unable to touch the floor, or you have any pain in your ankle or in your knee, this is going to be considered a fail. If you can sit back on your feet without any pain in your knees or your ankles, with the top of your foot where the shoelaces would be firmly touching the floor, this is considered a passing test. In the next assessment, we're going to look at your hamstring flexibility or muscle length. It is the exact test that's going to tell you whether your hamstrings are actually tight or not. So what you're going to do is you're going to lay down on your back, you're going to bring your one knee up towards your chest and towards your stomach, and you're going to grab your hamstring. You want your knee and your hip to be at 90 degrees relative to the ground. You're going to want your femur or your thigh bone to be perpendicular with the ground at a 90-degree angle. From there, you're going to continue to hold your hamstring with two hands, and you're going to try to straighten your knee. When you straighten your knee, your foot should be coming over top of your knee. A passing test is considered if you can straighten your knee completely with your foot over top of your knee without any pain in your lower back or in your knee. A failing test would be the inability to straighten your knee in this position. So this next test is a squat mobility test, but we like to use what's called the prisoner squat. So what you're gonna do is you're gonna clasp your fingers together, put them behind your head, you're gonna get your feet about shoulder width apart, and you're gonna squat down. You wanna get your butt to about the same level as your knees or below, while maintaining an upright trunk position and keeping your eyes up facing forward. So the next assessment is for shoulder mobility. We call this the prisoner stretch. And you may have seen this in different yoga classes or physical therapy or strength and conditioning programs. All you're gonna do is put your hands behind your back, and you can see my shoulders wanna come forward here, right? So the first thing that I'm gonna do is bring my shoulders back. I have to keep my palms touching together here. So I'm going to keep my palms together, my shoulder blades back, straighten my elbows, and lift them away from my body. In this, I should be able to get my hands about 12 inches away from my butt. If you can do this, this is a passing test. If you can't do this, you probably need some extra work on your shoulder mobility. And this next test is going to look at your hip range of motion and is also a pain clearing test. You're going to lay down on your back. You're going to figure 4 your leg across your thigh or on your opposite leg. So your ankle bone should be sitting on top of your thigh, on the front of your thigh, just above your kneecap, with your foot slightly lateral to the outside of your opposite leg. So we call this a figure 4 position. This test is considered passing if you're able to drop your knee down so your leg becomes parallel with the ground. If you have any pain in the front of your hip or in the back of your hip near your SI joint, this would be considered a fail for the clearing part of this test. So if you're unable to get the figure 4 leg to parallel during this test, this would be considered a fail for the range of motion or mobility portion. So in this next part of the assessment, we're going to look at your core stability and your glute strength. All you're going to do is lay down on your back. You're going to bring your heels close to your butt, probably as close as you can possibly get them comfortably. You shouldn't have any pain in your lower back or in your knees. So find a comfortable position for this. So as you're laying down on your back, you're going to keep your shoulders back and you're going to lift your butt up off the table. When you do this, I want you to pay attention to not excessively overarching your lower back. Once you reach the top of the bridge position, this is the beginning of the test. What I'm going to have you do is lift one of your legs off of the ground. So if we were going to lift this leg on this side off of the ground, as it lifts up, we want to be able to see this side of the pelvis raise up. If this side of the pelvis drops down, that's going to be considered a failing test or needs improvement. If this side of the pelvis raises up or stays even, we're going to consider that a passing test. We're going to do is called the forward bending test, and it's an overall flexion mobility test of your trunk. Also incorporates a little bit of your hamstrings in, but it's not a specific test for your hamstrings. It's just really looking at overall mobility. So all you're going to do is try to reach down and kind of like 5th grade gym class, we're going to try to touch our toes, right? And it's funny because most people really struggle with this, and what we want to be able to see is that you can reach down and actually touch at least to your toes or maybe even further. Ultimately, if you can get your hands flat on the ground, you're probably at an elite level. And this next part of the assessment is really a 2-part assessment, and we're going to look at everybody's favorite muscle, the abdominals. And we're going to break this down into the upper abdominals and the lower abdominals. So for both parts of this test, you're going to be laying on your back. In the first part of this test, we're going to test the upper abdominals. Lay flat on your back. You're going to put your hands behind your head in the full Nelson position. Sit up off of the table. While you do this, you're going to keep your legs straight. This is the challenge. If your legs are able to stay straight and you're able to sit comfortably up in this position, this is going to be considered a passing test. If you're unable to sit up straight comfortably in this position, or your legs bend or come off of the table, this would be considered a failing test or needs improvement. If you're able to sit up straight and keep your legs flat on the table, and also slowly return your body back to the table, leading with your lower back, then the middle of your back, then the upper part of your back, and then touching your head down to the table. If you can do that in a slow and controlled manner, that would be considered a passing test for upper abdominal strength. In the second part of this test, we're going to look at lower abdominal strength. And again, laying on your back, you're going to keep your knees straight and you're going to raise both of your legs together above your belly button. Your feet should be facing towards the ceiling and your lower back should be resting comfortably on the table. You should feel when your legs are up in the air that you have pressure on your lower back. If you need to test to see if you have pressure on your lower back, you can bend your knees, bring them up to your belly, hold them in, and then put your hand underneath of your lower back to feel where that pressure is on the table. To start the test, you're going to start with the legs up in the upright position above your belly. Remember, you're going to keep your knees straight and then you're going to slowly lower your legs down towards the table. What we're looking for here is that your lower back is able to stay on the table. If your lower back starts to arch or your pelvis starts to arch and come off of the table at any time during this test, or if you have pain in your lower back or your hips, this would be considered a failing test. A passing test would be considered if you can lower your legs the whole way down to the table without arching your lower back, keeping that pressure of your lower back firmly pressed into the table. What's the next assessment? It's hydration. And next to sleep, hydration may be one of the most important self-assessments that you can do for yourself. It's not 100% specifically accurate, but doing a self-assessment for your hydration in this way is something that allows you to give yourself some type of feedback regarding your actual hydration levels. One way to do it would be to really track everything that you're drinking and know how much exactly that you need, or you can actually do a urinalysis example of your urine to see what's going on. For you to check your hydration, all you need to do is when you go to the bathroom is to take a look at it, and it should be close to as crystal clear as this water. If you have especially a browner color to your urine, that really means that you're probably dehydrated. And medications and things like that can play a role, but for a simple hack and a simple self-assessment, your pee should be as crystal clear as water, just like what's in this bottle. In this next assessment, all you need is a tape measure. We're always thinking about, especially in health and fitness, and as well as in physical therapy, because this matters as well in terms of how much pressure you're getting on your joints and how you're going to recover from injuries. But looking at body composition, and what is body composition? Well, it's how much fat you have relative to your muscle mass and your skeleton as well, and looking at percentage body fat is one of the big things that people look at. But the little known thing that we learn in school is that it's actually your hip to waist measurement that really matters in terms of your long-term health. Simply take this tape measure, you're gonna go to your belly button, wrap it around, get a measurement, then you're gonna do the same thing and you're gonna measure right from these bones on the outside of your hips called the greater trochanter, these big knobby bones on the outside. So then what you do is you take the difference of dividing the measurement between your waist and your hips to determine what your waist to hip ratio is. For women, anything greater than 0.7, and men, anything greater than 0.9 is considered high risk for health problems. In the next assessment, we're going to look at your hip flexor muscle length. And again, this is another test like the hamstring muscle length. A lot of people out there are trying to do a lot of things to get straight to their hip flexor flexibility or their muscle length, and they're not able to do it correctly because they don't understand whether they actually have a tight hip flexor or not. So in this test, you're gonna lay down on your back, you're gonna keep your legs straight, and you're gonna pull one knee up towards your chest as far as you can. You wanna keep your knee and your shin and your ankle in line with your hip. You're going to pull it up so the back of your calf touches the back of your hamstring. As you pull this in, your leg that is straight on the opposite side should stay straight and touching the table. A failing test is if I can't pull my knee into my chest, touching my hamstring and my calf together while maintaining a straight leg on the other side. A passing test would be considered if I can pull my leg up to my chest, keeping my hamstring and my calf muscle touching while the other leg is straight. The next test is what I call the BOSU Balance Strategy Assessment. You're going to need a BOSU to do this test. Lay the BOSU down in front of you. First, you want to start with the round side up. You're going to step onto the top of the BOSU, placing the middle of your arch on top of the circle on the BOSU. Once you're standing on the round side of the BOSU, you want to try to maintain your single leg stance for about 10 seconds. People will typically use one of two types of strategies when they're trying to maintain their balance in a single leg stance. They will typically use their ankle or they will use their hip. Traditionally, the thought is that women have a more of a higher tendency of favoring an ankle balance strategy versus males having a tendency to use a hip balancing strategy. You're gonna flip the BOSU so the black side of the BOSU is facing up. The round side of the BOSU is going to primarily work more on your ankle as you're standing there. It creates an unstable surface for your ankle to have to try to strategize to keep you upright and maintain your balance. By standing on the flat side of the BOSU, it's going to take your ankle out of the equation and you're going to have to figure out if you can balance using your hip strategy. Once standing on the flat side of the BOSU in a single leg stance, you want to try to hold the position for about 10 seconds. As I said before, we definitely see a difference between men and women with this test, but it's not always consistent, so we don't want to assume that you're just going to fall into one strategy or another. When we look at injuries and the differences between injuries in men and women, we tend to see a lot of non-contact injuries, especially in the lower extremity in females. They tend to think that women have more non-contact injuries in their lower extremities because of this difference in the balancing strategy that they use. So in this next test, we're going to look at your hip mobility as well as your balance. While you're standing on a stable surface, all you're going to do is bring your knee up towards your chest and grab the front of your knee just below your patella with two hands. Your patella is your kneecap, and you're gonna pull your knee up towards your belly, and you wanna bring the knee above the level of your hip, and you're going to put it straight down. This test is considered passing if you're able to bring your knee directly above your hip without deviating from side to side and without losing your balance, while also placing your foot directly down below and returning to the same stance that you did when you were in the starting position. I'm Dr. Lanil Mitchell, and I wanted to say thank you for tuning in to our mobility self-assessment program, and I'll catch you on the next video.